Hello.
Hello, hello.
Hi.
Hi.
Good evening.
All right.
Oh, I was talking to everyone and I'm muted. I didn't realize that I was muted. I was having a conversation by myself. Hi, everyone.
How are you?
I'm okay. Tired, but I'm okay.
Yeah,
Mhm.
me too.
I've been on Zoom from 11 o'clock this morning.
Oh,
Oh
God.
my God.
Same.
Oh my goodness.
It's too much.
Mm-mm.
I know.
Yeah. It's
Yeah,
all-
hope everyone doing good.
Yes, you?
So sorry to keep you guys waiting because we are just coming out from a meeting with the sexual harassment and it was such a wonderful presentation.
Oh.
So that's why we were running late. So it's now 7:08, so I don't want to keep anyone waiting any longer. And I just want to say good night to everyone once again, and thank you so much for joining us this evening. My name is Francisco Leopold. For those of you who don't know me, I'm the second vice chair at the Community Board 9, and I'm also the chair for the Health and Social Services. And with me tonight, and for those of you who have not met our new DM, our new district manager, he's with us tonight, and I will let him introduce himself and also give a few words before I know he have to go and join another meeting. So I'm gonna, open the floor to him right now so he can give us a few words.
Okay. Well, hello, everyone. Well, hello to everyone I've not been able to meet before. I know a couple of you on the call, so it's a pleasure to spend a little time with you. My name is Dante Arnwine. I'm the new district manager for Community Board 9. I'm actually very pleased to be able to hop on this call. I'm running back and forth committees to committees, but over the past 3 weeks since I've had the job, I've had a couple of conversations with Fran and ended. So I'm really looking forward to working with this committee. You guys have great leadership. I can go ahead and tell you that from the start. You guys, I've seen some of the agendas that you've had from your committee meetings, and so it looks like you guys are really putting in the work. I look forward to working with you. Just know that I might not be able to make it to every committee meeting, but you can definitely always call the office or shoot me an email if you ever need me. I'm relatively accessible, and some people say that I'm friendly. So if you want to talk and just call me up, that's fine as well. But I look forward to working with you guys through your committee work.
Thank you so much. Thank you. So for those of you who, okay, so we have a few, okay, so we are 9, so I'll say given 7%, so I will just let each one introduce themselves so we know who our partners are. So we're gonna start with Rashida.
Good evening, everybody. My name is Rashida Sykes. I am a longtime resident of PLG, AKA Flatbush. I'm also a board member on Plegna, Prospect Left Gardens Neighborhood Association. And I'm also program manager for the Phoenix, which is why I'm here. So hello, everybody.
Welcome. Ms. Dillard.
Hi, good evening, everyone. My name is Ina Dillard. I'm the Director of Marketing and Public Affairs for Kingsbrook at One Brooklyn Health, and it's my pleasure to be here with you guys tonight.
Okay, Mr. Rublin.
Good evening, all. My name is Mike. I'm a caregiver social worker with Heights and Hills located in downtown Brooklyn. We just started recently covering a lot of the area of this district, so I'm going to introduce myself later and see how we can be of help for elders and family caregivers.
Thank you. Ms. Flatto?
Yes, my name is Adele Plateau. I'm the president of the National Association of University Women Brooklyn branch, and we have a very active health and wellness committee.
Ms. Blair? You're muted.
So sorry. I am Alice Blair. I am the Vice President of the NAUW, National Association of University Women. As Ms. Plateau just said, she's the president, and I'm also an employee at Elton Hospital Corporation that I work for the Sexual Assault Response Program for the Borough of Brooklyn, and I do supervision for the hospitals that has the program in it. So I have two
Okay.
hats.
Are you finished, right?
Yes,
I think I was just talking over you.
No,
Okay, Ms. Payne, Pamela Payne.
Sorry, good evening. Hi, guys. It's Pamela Payne. I am a New York State Network for Youth Ambassador and a community member, and excited with being here with you guys. And hopefully I can be a part of the team and be a great leader with you guys.
Thank you, Melissa.
Hi, good evening, all. My name is Melissa Sever. I'm a resident of Flatbush, also known as PLG, although I didn't know that was the name when I was growing up. And I'm also a member of Community Board 9 as of last year.
And
I'm on the Health Committee, co-piloting with Fran.
thank you. So I want to make you understand something that this disclaimer right here. So anytime you ask to come to do a presentation in this committee, and anytime you come here, and you can ask, Enid could attest to that, we kidnap you. You become family, right? You become family. So anytime you come to HSS, you become families. You become Community Board 9 family, but not only Community Board 9 Health and Social Services family. So whenever you come on this platform, remember you are being kidnapped. So come again. Don't let tonight just be the last night that we see you. Please do come again. And this month, for those of you who missed our cooking during healthy cooking during COVID, it was phenomenal. It was great. And wow, you know, I was supposed to get some salmon to really practice that cooking, but I haven't done it yet. And they just showed us, the chef showed us how to cook some salmon with spinach, and it was, I mean, we were home and we could smell it simmering on the stove. So you know how good it was. And so for next month, we have another segment again. But with that, we had a presentation dealing with diabetes. So next month we have another healthy cooking in COVID again, and we will be dealing with addressing the, obesity. And then we have one of our community members. And as I said, anytime you come to this little group right here, you become family. I personally kidnap you. I already made connection. Everyone at the 71st precinct, they are my friends. You cannot report me. I wouldn't get arrested. So I could kidnap as many as you as I want to. So Mr. Cummins from Malika Samuel's office, he came, and then he gracefully accepted the challenge to be our chef in June. And June, I think it's Men Health Month. And then he'll be cooking, and then we'll be addressing men's health, prostate cancer, and a whole lot of areas that affects men. You know, men, a lot of our men, you know, they don't like to go to the doctors until it's too late. So we are so happy that we have a male figure who is coming out. He will do the cooking, and then we'll be giving them some information as to how to take care of themselves. And then we just had Miss Blair, who just did a wonderful presentation on sexual harassment. And it is something that, as I said at the presentation, there are a lot of things that plague our communities, and then it becomes taboo to us. So we have to go in our closet. We close our doors to discuss it. And these are things that really affect us, but we don't like to address it. So I was so pleased with the presentation. I'm looking forward for us to have a second presentation, because I think that we need more people, because we have young ones who are experiencing sexual harassment, especially during COVID. And I don't know how many of you all have seen the statistics that since COVID, we had the percentage of divorces when skyrocketed. People who live together, they're separated. You know, it's just so much have been happening because people never used to spend time together. But COVID, you know, had people, and so some people got better and some people got real bad. And we know young children suffered, women suffered, men across the board, everyone was suffering. And when it comes to sexual harassment, and she just did a wonderful presentation, and in layman's terms, everyone understood what was said. And even as she is here, and Ms. Plato, I know Ms. Plato still have all that information, and then Ms. Plato can still put those information in the chat. So some of you who know of anyone who have experienced sexual harassment, if you have experienced it, and as she said, she have this at her office is that she have a Vegas slogan at her office. When you go to Vegas, when you leave Vegas, what happens there? You leave it right there. So that is what she has at her office. So when you go to her office, anything that is discussed in her office, it stays right there. So if you have any issues, you know, when you live there, it stays there. So you know of anyone, a family member, a friend, or anyone you know who are experiencing that. And as for me, I know that there is the sexual harassment hotline, but for my 9-to-5 job, I'm the associate human rights specialist at the New York City Commission on Human Rights. And so these are some of the areas that we address as well. So anyone who is suffering, anyone who's going through any sort of discrimination or sexual harassment or anything, you can let me know, and then we will address it. It will be done with no names called. We'll just address the issue, investigate it, and we'll address the issue. So without any further ado, I know we have Ms. Rashida, and then we also have Mr. Roblin, who would like to make a presentation. So I will first call, you know, since you are family, I'm gonna call you Mike. So Mike, you know, the ladies have to go first, right? So I'll allow the lady to go first. So Rashida, the floor is yours.
Thank you so much. I want to thank the community board for having me. Like I said earlier, I've been living in Flatbush all my life, and Community Board 9 is near and dear to me. Although I've tried to make it some of your meetings, I haven't consistently done that, but I'm glad I'm here now. And, you know, it's so fitting that, you know, I'm here for this health committee meeting, because I'm here to talk a little bit about health. And my health journey came from about 7 years ago when I started working out. And I noticed the effects it was having on my mood, you know, and not only my mood, but my body. And, you know, realizing in the pandemic, the need for movement, the need for some type of physical activity. And as we know in the Black community, unfortunately, this is another one of those things that we don't do enough, you know, to prevent certain health, you know, health outcomes. So fast forward, I got this new job. I'm the program manager for the Phoenix. And they just started this new chapter here in New York City. They've been around since 2006. And so they're coming here to New York City to try to tap into some of the communities that need to access fitness, that may not have access to free programming and free fitness. So I do have a PowerPoint. And if I could, oh, I can't share. No share.
Just give me 1 second. I will make you a co-host, and then you will share screen.
Yay, thank you.
While we waiting, Ms. Francis, can I ask a question?
Sure.
Is sexual exploitation for children and youth part of that?
I think Ms. Blair is there. Ms. Blair, are you?
We
Ms.
can talk
Blair
offline.
would be able to.
Can you see my screen?
Yeah.
Yes.
Yes, we can see your screen, but Ms. Blair would be able to answer that question when she come back on.
Hold on, I'm trying to get the bar. Here we go with technology. Bear
You
with
trying to
me.
make full screen. Let's see. I think it was up. Click what you clicked a second ago.
I'm trying to.
We need to go. We need the
Right
ribbon.
there,
Yeah.
right there.
So if you go
Yeah,
to
but I can't see it because of the bar, this black bar.
oh,
Yeah, I'm trying to get there,
You
but I
look-
can't.
If you look, move your mouse right where it says insert right above it and press on that little thing in front of insert.
right.
Wait a
Go
minute.
back again and click again on that bar because
Yeah.
you remove it. Right, click
Right,
on
I
it.
see the bar, but it's not, it's hiding my,
All right.
This-
We'll coach you. Go to the left.
thank you.
Okay. A little bit to the left, just a little bit,
Mhm.
slowly. Okay. Oh, okay. Go to the right, just a tickle.
I
Just the-
can't, because what I'm saying is, wait,
oh, I
you
see
see
what you're
this,
saying.
you see what I'm saying? This bar
okay.
here.
Way. Okay. Put your cursor on that green bar. You can move that bar.
Okay, let's see. Uh-oh. Yeah, that's weird.
Yeah, you should be able to move it and get it out of your way because I just moved mine.
Really? Oh my God.
Where it says-
Yeah, it's not really letting
It's
me.
not letting me. Okay.
All right, you know what? I'm gonna do it as it is. So as I said earlier, I am the program manager for the Phoenix, New York City, and we are a nonprofit organization, and we incorporate fitness to those that are recovering from alcoholism, substance use. So it's a new dynamic way of looking at recovery. Not only recovery from substance use, but from people that are, like right now, everybody's going through something with the pandemic. So we're utilizing fitness and movement and art programs in order to bring people together. So that's anybody that's overcoming trauma right now, trying to work on mental health conditions and lower their symptoms, things like that, because we do know that fitness and movement is scientifically proven to kind of combat some of those symptoms. So I'm gonna go ahead to the next slide. I wish I had it on slideshow. So I think I mentioned earlier, we were founded in Colorado back in 2006, and now we're in 22 states. So we just came here to New York, and some of the things that we provide through a national website, so that means people can actually access these activities for free online, yoga, and these are taught by like personal trainers, certified trainers, yoga certificated, people who have yoga certifications. So we have art night. I just started a run and a walk every other Saturday. We do this at Prospect Park right here. And so that's a bi-weekly event. It starts with a run at 9 a.m. and then we walk. And so it's just a good way to connect people, especially now during this pandemic. And we've been quarantining, there's so much going on. I tell you, that movement and just being with other people is so important right now. So we have game night, we have high intensity interval training, community fitness, all these things are taught by certified personal trainers on our website. And so through these activities, we try to connect. It's like a supportive network of peers. Most of the activities are peer-led. That means these activities are being led by people who are either in recovery, who have experience with recovery, and so it just really helps people to sustain their recovery. Not everybody can do 12 steps, so we do support all pathways to recovery, non-traditional ways. Some people go to church, people battling addiction, they might get it through church, they might get it through other means. So we support all those pathways. So this is not your regular, I'm gonna go to the clinic. That's the first thing we do when someone has an addiction. And I'm not knocking those types of modalities, but time to, innovate. This is very innovative and it's like proven track record, And so the next slide. So we launched in 2021 right here, as I said, in New York. And currently, the first thing that I started was the run walk, because it's something that I already do, right? Especially during the pandemic with the gyms were closed. So I found myself working out at home or going over to Prospect Park safely, of course. And so that was one of the first things that I tried to organize that we have at the park. It's for free, people can sign up. Like I said, the run, it's not to be intimidating. It's for all levels. You don't have to be like a, fastest runner. And then also another thing that we have been moving forward with doing is we also conduct online Facebook Live classes with personal trainers. And so you can log onto our Facebook page Monday through Friday, and you'll see a personal trainer actually doing movement. That's something that you can follow through. Anybody can kind of join in on those. And also we have meditation. So we're hoping to expand programming, throughout New York City. Like I said, because I am a member of Flatbush, of course I had to start it off right here at Prospect Park. And it's just really gonna be beautiful as the weather starts to get warmer, and we're all craving this connection. It's like we're meeting new people, and the conversations that come up are also very therapeutic. So it's all about moving forward and kind of innovating and thinking outside of the box when it comes to treatment and recovery, but not knocking other modalities of treatment. But this is like an enhancement to those other
In addition
recovery
to another approach.
Yes, another approach, or it can work in conjunction with
Yeah.
12-step or with someone who's going to outpatient programming. So, we really want to spread the message that we hear. And so for the future, we plan, as a matter of fact, we have partnered with a nonprofit called Brooklyn Community Services out in East New York. So we're going to be offering indoor fitness classes to that community. Where they'll be able to access, of course, by socially distancing, adhering to the COVID-19 protocol. And so we expect in May to have some indoor fitness classes out there in East New York. As I said, the outdoor fitness classes are starting with the run and the walk. And then we're looking to expand not only fitness, but art, music, photography, poetry clubs, especially now. I mean, art, all that kind of therapeutic stuff is really focused on bringing people together through things that they can enjoy. So we really want to collaborate with local organizations and get the word that we're here, get the word out, and have people come and join us. In the future, we hope to connect with private gyms if we can, once we're stabilized with COVID-19, of course. And so
just before you move on, how many slides you have? Because we have another presentation.
I have one
so
more. I have one more.
Okay.
I have one more. So this is just quickly, this just lets you know how people can join. So even if someone wants to come on with us and lead a group or lead an activity, we have a volunteer coordinator who can be contacted if someone has a talent in music, art, photography, anything like that. If you want to join a class, people can sign up at thephoenix.org or contact me. I can pop my information in the chat. And all the programming is free, which is totally like never unheard of, free fitness classes. So,
Yay. Wait. I just have one more question, then you could go.
sure.
Do you have to be on some kind of substance to be a part of this?
I'm glad you asked. So we do focus on those that are in recovery, and you don't have to be in recovery or, recovering from a substance. You could, we're all going through something right now with this.
Okay,
pandemic.
cool. That's all I want to know.
No, you can come. We are open to all. So that leads me to my next sentence. So we're all individuals who are facing some kind of trauma right now with the pandemic and the news and everything else. So overcoming pandemic-related stress, anxiety, depression. We just want to help improve the mental health conditions for all New Yorkers, which a lot of people are suffering right now. So that is my last slide. You can check us out at thephoenix.org. I will drop my information in the chat. And I hope that I can share.
Rashida, what I would like to say about this is, you see, many times, because we've been discussing mental health, and bringing awareness. And I know there's been a lot of awareness programs that have been presented in the community, but most times it's a lot of talking. People sit down and it's a lot of talking and people are just hearing words and words and words and words. And then at one point people start hearing like Bugs Bunny because it's just so much talking that's going on, you know. But I just love this. So I'm happy that you are here right now, and you've made it even harder to lose you. So we're definitely now I'm gonna ask the district manager to get some shackles for you, because we're gonna keep you, right? Because we're gonna be in, we want a game night, and we want a game night where people can just come and just sit down and just, you know, have some fun and just laugh. And then we also, I love the yoga. I love the yoga, and then an afternoon, late afternoon, Sunday, whatever time. It could be a Thursday night because my space is always open on a Thursday night, and we can have some people. Let me tell you something. I know that none of you all want to see me doing yoga because I sit here, you know, and I'm, you don't want, I would pop. I'm like a rubber man, a still rubber man. I would pop. So we need some yoga. We need some stretches. We need to do something. Yeah. I so love this. So we need to, let me see, if you come on and it's just myself, we're doing yoga. You know, I don't get, we're doing something. So we're gonna have a night, and I'm sure each person they saw would love to come and then invite somebody, and we'll have some fun. Okay, so we're gonna, so you're gonna put a game night together. I'm not asking you. Yeah. I'm gonna tell you that you're gonna put a game night together and a yoga night together, and we're gonna have some fun.
Rashida.
So thank you so much for coming. Yeah. Thank you so much, because I'm on something. I might not be on a hard drug, but I'm on work drug. I'm drunk in work. So I need some release. I need to do something.
Yes, and it's so good. It's so good for the spirit. It really is.
Rashida, Alice, I'm so glad that you said we don't have to have any addictive. What is called for us in healthcare is vicarious trauma. Right. So we need to have that release, you know, because like, I can tell you a lot of my colleagues would say, well, we can't join because, you know, we're going to be associated with recovery. But to hear that the fact that we can become a part of something that can have nothing to do with work makes it pleasantly surprising and accepting for me. So I think that's a great, at least trying to find somebody out there that is good at exercising to get me up off the couch.
Yes, and I'll tell you, I have a couple of people that come out so far. The next one is actually this Saturday at Prospect Park. And so we meet at Grand Army Plaza. I mean, everybody's welcome, you know.
I'll be looking for you. I need an excuse to get up off.
For those of us who really cannot go out there, we're gonna be in our living room and push everything on the side. And we're gonna do something right in our living room. We're gonna be fine. We'll be good.
That's right.
So yeah. Anybody else have any, before we go to
I have a question.
To Mike, anyone have any questions for Rashida?
I do.
Go ahead.
I do. So I hear you saying it's Saturday, but what time? And is there somewhere in that last slide that you gave that we can look up stuff? Because I don't live that far from Prospect Park, so I wouldn't mind coming, but I don't have enough of the details.
Oh, okay. I popped my information in the chat, but I didn't pop it to everybody. I see what I did.
No, I joined it. I had to come in a little late because I was working, so I don't have the information.
All right, so it's this Saturday. The run is at 9 a.m. and it's really a leisure run. It's a comfortable run, and then we do a walk. So you could either sign up for both or come to one.
And where do you meet? In the main entrance?
We meet right under the arch at Grand Army Plaza.
Okay.
Yeah.
And so what time is the run and then what time is the walk?
The run starts at 9 and it's followed by the walk at 10. And some people do both, some people do one. You know, so so fun.
That sounds like a plan.
Yes, come on out. I'll be glad to see you.
Yeah, when you have upcoming events, make sure you send it to the to our office, and I'll make sure it gets put in our newsletter that we send out.
That would be so good. That would be so good because I get all your emails. So just send it to. I get all the community board's email. Just send it to CB9 email address.
Yeah, send it there and I'll make sure you can put in the email that Dante said to send us here, put it in your weekly newsletter and I'll tell him.
Gotcha. Perfect. Thank you so
Yes,
much.
definitely. Thank you so much. Thank you. Mr.
Okay.
Cummings, thank you. I was getting a little worried because I didn't see you. So I was wondering if you know, if you're dishonest tonight. So I'm happy. So this is our chef for June. This is our chef for June. So hey, invite somebody and come and see him. Okay, so thank you so much, Rashida. And Mr. Roblin, the floor is yours.
Cool. So I'm kind of piggybacking a little bit off Rashida. I love the work y'all do. It's wonderful. And it's maybe an appropriate lead-in since a lot of what we do is like somewhat similar. So I'm with Heights and Hills. I'm a social worker. And to be specific, I'm a caregiver social worker. Heights and Hills is located in downtown Brooklyn. We are a nonprofit. We are completely 100% free service that supports both elders and the families that are caring for them, or the non-families or whoever. And the tie-in there is that we run, I don't know if any of you have heard the Park Slope Center for Successful Aging, but I guess it used to be called the Park Slope Senior Center. Basically, we've been doing everything from yoga, where for this case, it's chair yoga, meditation, Tai Chi, Qigong, Spanish, Chinese lessons. I mean, you name it, we've done it all. A lot more recently with meditation, but it's gone all virtually. We had a program set up with elders and families who are unable to access computers or needed a little bit of training on how to use Zoom or WebEx or anything. We actually had grants earlier in the pandemic, maybe in April, May of last year, to actually come in and teach them how to use it. They were full PPE, the whole shebang. So we do that as one of our healthy living and aging in place initiatives, which is huge. Again, you can live pretty much anywhere in Brooklyn. We cover most of Brooklyn outside of Bensonhurst, Coney Island, and there's one other area down there, but Sheepshead Bay. There we go. So we cover this area. We just expanded recently. We got the grants from city councils and from the mayor's office to expand. So this is part of the reason I'm here. I just wanted to introduce myself. Outside of that, right now we're serving about 5,000 elders and their families. So it's looking close to 10,000 people in Brooklyn. We serve literally anyone, no barriers regarding money, citizenship status. So you can be undocumented, documented, a millionaire, you could have no money, whatever the case is, we're here to help. One of the main things we do outside of healthy living initiatives is we help people with aging in place, our families that are caring for them, connecting with resources. We run a large Meals on Wheels program, which I'm sure most people have heard of. Meals on Wheels actually for the first time since its inception has seen it at capacity during the pandemic because everyone wanted Meals on Wheels. Understandably, people don't, you're immunocompromised, maybe your immune system's not so great as it once was, so people were afraid to leave their homes. So we actually started a completely new, a separate entity called the Shopping Squad, and we worked with local groups to, we have a volunteer program that actually helps people shop, and we have grants that help provide, if people are really low income, we cover groceries up to $50 a week. So that's been a really valuable thing. And now that we're expanding, we can introduce it to this area as well. We have a large volunteer program in general. So if it's something that you're interested in, we can always use volunteers. We're not in-home style just yet, maybe in the next few months, maybe later in the summer, but we always need people to make wellness calls. Just there's so many clients we have, and we only have so many people employed. So just to call and check in, a friendly chat on folks who might be homebound or living alone, or maybe they live with someone but they're working right now, and just to combat isolation and loneliness, which is a really detrimental to health, especially for people 60 and above. And we're all dealing with, as someone mentioned, the vicarious trauma, the collective trauma, from the pandemic has been so important. So we've been doing a lot of that, and lastly, I'm with the caregiver program. We run, and I run a number of them, support groups that are, again, free of charge. They help people who are usually family caregivers just navigate stuff like dementia and Alzheimer's, coping with anger, frustration. We have one that's focused on long distance caregiving. So let's say mom or dad or auntie is living out in, like, I don't know, California or Philadelphia or Atlanta. We have, that's like an extra added stress. So we help them kind of navigate that. We run workshops, particularly around long-term care. So we have, we work with a number of attorneys that actually are doing pro bono work with us. And it's all virtual right now, and they'll come in and explain, you know, for people that are new to it, how do we get a power of attorney? Or maybe my power of attorney is not good enough, or mom has dementia and she started doing some odd things with her bank account. And what do we do in this point? Like, what rights do I have? Healthcare proxy, what does a Medicaid application look like? All of that they can provide on these workshops. They're all virtual. You can sign in like we are via Zoom, or you can call in. We actually have one on Monday. That's a legal financial seminar. That is our partnership with Caring Kind. So it's discussing all of that, but it has a little bit of focus on dementia and Alzheimer's. Yeah, so that's all of us in a nutshell. We do a lot. We're like the jack of all trades, but we help essentially about 5,000 to 6,000 elders plus their families. And I personally, you know, I've lived in Brooklyn most of my life, and I have been a caregiver for both my sister and for my grandma who had Alzheimer's when she was living with us. So I have some personal experience with it. And, you know, we just wanted to share with you guys what we're doing right now. And I'm happy to answer any questions, and I can drop our website.
Mike, I just want to say something that you just, I think you're one of those people who like torture, because we just kidnapped Rashida, and you put yourself in the same category to be kidnapped as well. So you know you'll be shackled together with her, because we need you, because we deal with a lot of the senior centers, you know, a lot of seniors, and I just love my seniors, and we know we have a lot of seniors out there. A lot of the services that are out there for them, they don't really get to use it, because sometimes their families are so busy, you know, and it's like I was about to ask you, do you offer services when it comes to SCREE, you know, to let them know so they can get whether the payments and stuff for their homes and stuff. So that could be an area that they can get help as well. You know, so I'm hoping that you'll put your information in the chat so Melissa could have it and we can have it, because definitely we want you to come back. And then there's certain programs that we have, and there is one senior center that I'm thinking of, Fenimore Senior Center, and they really need help there. So there are a few senior centers in our district that we work with, and then we know that they need the help, and everything that you're offering right now, we know that they would be so happy to get the services. So I thank you so much for bringing this service to us. You know, I really do appreciate it, because when I think of the services that, you know, what our seniors are having right now, because some of them, even during COVID now, because of health issues, and I know you spoke about food delivery, and we had seniors since they were home, so the centers are closed, and the Department of Aging, they took over, so they were the ones who would get the food and take the food to their homes. And some of those people, when they, because of health issues, they would not eat the food, you know, and a lot of those food, they're the frozen food, you know, and then, you know, the fruits and everything, they were not getting enough nutritious food, the fruit that they really need to eat. So they would just leave them. So these are areas that we really need to address, you know, when it comes to our seniors, that we need to take better care of our seniors, you know. So I am so happy for, you know, for you being here and bringing this program to us. So before I call on Mr. Cummins, I would like to, Enid had a great event yesterday, and I would like Enid to just speak to us on what happened yesterday for our community. Enid?
Thank you so much. Yesterday was fantastic. We had Dante with us, as well as Miss Fran, as I call her, and we opened up, reopened Pierre Toussaint Family Health Center, which is right there on 1110 Eastern Parkway and Utica Avenue. And it is a part of Kingsbrook at One Brooklyn Health. And a lot of persons have heard us over the last few months talking about One Brooklyn Health, and conceptually, well, what is that? Well, it's a consolidation of 3 safety net hospitals in Brooklyn, including Kingsbrook, Interfaith, and Brookdale. And part of that consolidation was to be able to be more effective in how we distribute healthcare, being that we needed more of our outpatient and ambulatory care focuses to keep people healthy, understanding that people need hospitals when they're acutely ill, but we really do want to focus on keeping people well. So that new center is fully renovated. And I'm just going to give you a few points about what really is happening in terms of the advancement there. The total visits for Pierre Toussaint in 2019 was about 16,000. With the new facility, we know that in 5 years, that growth is going to be adding at least 28,000 visits. And the expansion and the advancements of that clinic will then allow us to see more people in the community. The on-site specialties are endocrinology, which is diabetes focused, cardiology, because in our community, there is a very elevated level of congestive heart failure, general neurology, podiatry, general surgery, GYN, and the additional services that we added on that site as laboratory X-ray. We have a health coach that deals with a diabetic prevention program before those who are, you do have to be diagnosed as pre-diabetic, but really working on a fitness and nutrition program to help you alleviate that. We have a nutrition department, social work, clinical pharmacists, and behavioral health via telemedicine and on-site as part of the intervention for primary care, because behavioral health, as we've discussed several times here, and emotional wellness is so important that it is becoming a part of the primary care component. And lastly, some of the facility features are adding 16 exam rooms and 10 telemedicine consultation rooms and a community education room. So we want to be able to offer space to our community members. Kingsbrook has always been big on that. We have a ballroom currently on site, but now at the sister site, at the sister clinic, Pierre Toussaint, with this new community education room, once we start getting back to normal, it's a space that our community can come and have health programs, seminars, workouts for Phoenix if you need, and meditation and yoga, all those wonderful things. So we were very, very happy about yesterday to have some of you with us.
Thank you, thank you, thank you so much. Can you let them know where the place is located?
Pierre Toussaint Family Health Center at 1110 Eastern Parkway and the corner of Utica Avenue. And they will be reopening probably by the end of May, right? And so that they are taking new patients. So whatever information you need, I'll make sure to put it in the chat so you can give me a call or call the staff for more information.
Thank you very much. Mr. Cummins.
Hello and good evening, everyone. Thank you for having me. Maurice Cummings from the office of Councilmember Alika Ampry-Samuel. Ms. Enid, that event I heard was amazing yesterday. My principal was there along with one of our staffers, and she said the facility was absolutely amazing, and she got a complete tour. She got the tour and everything, and wishing you guys great luck over there. That's a much needed service that you guys are providing in the community, and many people are going to have an opportunity to take advantage of it. So great work.
Thank you.
You're welcome. Listen, I'm preparing for June. I've got to switch my dish up. Young lady cooked the salmon. I mean, I got a couple of ways I'm gonna cook the salmon. I could cook the salmon, but I'm looking forward to cooking for June. I'm staying healthy. I just actually went and had a prostate exam the other day, last week. Everything's fine with me. Taking all my grown man over 40 exams so I can reach the golden age of senior citizenship and still be able to run around with my children and my grandchildren and so forth. So always great information here. Good to see folks, and I'll see you. Who do I need to communicate with that as far as that, by the way?
I didn't get a question.
Oh, who do I need to communicate as far as, what I'm cooking, run of show and all of that stuff? I'm sure that's just a question that I had. I can hit you in the chat or something. I don't want to take up time for the meeting, but I just.
Oh, you can liaison with Enid. Enid, just put her number in the chat so you could liaison with Enid.
Yeah, I can definitely give you a call and we could talk about run of show.
Okay, perfect,
Okay,
perfect.
Can I
I'll
just
send my
mention,
information
Oh,
in the chat, okay?
can I just mention also that Dr. Simon agreed to come back in June? So we need to make sure that he's included in their program. You know, he's going to be speaking about men's
Okay.
health issues.
Okay,
Harold Simon.
fine. Thank you. Thank you so much.
Mhm.
Warren, Mr. Burke. Thank you, Adele. Warren, floor is yours. You're muted, and we want to see your face also.
Hi, everybody. I apologize about that. I had to get into the app. First of all, I just want to thank Francesca for what she's been doing. I have to show my face.
Thank you.
Prior to this meeting, Francesca has been developing with Kings County Hospital a number of webinars. And tonight was on, I believe, sexual abuse. I had another meeting, but this is the first time we've had a cohesive strategy from the community board that once a month we're having these presentations. And I just want to thank Francesca for initiating that. The second thing is, as I am the chairman of the Kings County Hospital Advisory Board, and I just wanted to report some things to you. We had a board meeting tonight. Probably the most significant thing is that number one, with the Johnson & Johnson vaccine serum, none of the batches that were not acceptable were distributed in New York. The second thing is the vaccine, the Johnson & Johnson is going to be, we have pilot programs at Bellevue Hospital, but basically, once they're proven safe, and only when they're proven safe, the plan is to use those one-shot vaccines for people who have problems getting to a facility, and it doesn't matter which facility, as well as an inpatient program where people who are both behavioral health as well as ambulatory will be getting those shots if they agree to it. The other thing that I never realized, and I was happy to hear this, there's a whole bunch of patients and residents who have post-COVID syndromes, and there have been 3 facilities set up in New York City to deal with the post-COVID symptoms. And these are symptoms that people have 3 weeks or 4 weeks after they either have COVID. So the program there's been 3 specialty clinics set up in Brooklyn. It's at 850 Broadway. And these are clinics where people who have either have respiratory problems, and surprisingly, there's been a big increase in mental health problems from having COVID that people can go to. So tell all your stakeholders about these clinics. They're through Gotham Health, and they're called Centers of Excellence for COVID. So thank you.
Thank you so much, Warren. I have to change my computer because I was having a problem with the other one. It kept freezing.
Okay.
Okay, so I just want to, I'm looking, Miss Soul and Pamela. And also before we go, I would also like Miss Blair to say a few words. But Miss Soul, when you came in, we had already started, so I don't know if there is anything that you would like to tell us. Introduce yourself.
Sure. Hi, my name is Sol. This is my first meeting with this committee. I did do one general meeting and then one youth committee meeting. So I am the CEO and founder of Soul to Souls Incorporated, which is a nonprofit organization focused on youth and young adults. And what we do is utilizing the creation of film that are issue-based types of film that we create with our participants. And we utilize it as a catalyst and a way to do social emotional development, leadership development, and social emotional leadership development. And I'm like blanking out on my other thing that we do. Oh, college and career prep. There we go. And so there's a lot of other things that we're able to do, but I've lived in the community for about 20 years and have always said, I need to get involved. I need to get involved. I need to get involved. So the pandemic is here. I have no excuse. It's time to get involved. So I definitely want to, be a part of the team. My background is I'm a licensed master social worker, as well as I have an MPA, and I've been working through different schools within this community. Actually, I've worked at about 3 or 4 different schools within Crown Heights, as well as partnerships that I have with schools within the Brooklyn community too, that we do, provide services to. So I just want to, get involved, jump in and help out in any way that I can.
So thank you and welcome. And I guess that when you came in, you must have heard my threat that I am kidnapping people. So
what are you kidnapping us to do?
There's a lot to be done in the community. Our community, I mean, the more we do, and the more it's just like when we go out there, and our DM, he just came on board, and I must say kudos to him, because as soon as he even before he started working, he already rolled up his sleeve, and then he started getting his feet wet and his hands dirty, and he started going around the community, and he's so eager, to do for the community, and that's what we want to do. And we don't want to just leave him standing alone with because he's the DM, that he's just carrying the mountain on his back. So we want to share with him, and then because our community is in dire need, and sometimes you find that you will hear a lot of criticism and you hear a lot of noise, but the people who are just blowing, they're just blowing air, but they're not coming, they're not being part of the solution. There's just a lot of complaints and complaints and complaints, but people end up being part of the solution because you don't have anything to offer, and you see that this is something's being done, it makes them look bad because they're not doing anything. So they're trying to discourage you to do what you need to do the things that you need to do. So we have to come together and just work together, because when you have the link, and if there is a broken link, then that chain becomes weak. So we have to come together and work together, and each one of you comes with something different. Each person has their own talent, So we have to just put this talent. Everybody comes to the table. We have a dish that we are preparing, and just one person then have all the ingredients. So we all have the ingredients, and we are all bringing this ingredient together in that pot. And guess what? When we finish, that pot can taste so good. It can be real good, and other people on the outside, they would be like, wow, what's going on over there? All that noise and everything we're hearing about those cooks over there, and just see how good that pot tastes. And they will want to come and ask us, well, how did we put this thing together? And we need to show them, you understand? So sometimes when negativity comes, and a lot of people who wanted to come to the board, and they will say, oh, we always hear all this noise at community board, and the old people say misery like company. So so we need to just push that on the side and leave the negativity on the side and just come together and make it work for our community. So I'm so happy for you all being here today. Before you go, I need to hear from Ms. Blair. And is there anyone, Pamela, I just need you to say something before we go. And Ms. Blair, I know you did a great job. So just give the family right now just a little something on your presentation tonight, and then I'll hear from Pamela. I always like to give each person an opportunity because we are a family right here. Go ahead, Ms. Blair.
I just want to say thank you for the invitation and the opportunity to try and get the information out to the community, because what I do really needs everyone to be aware and bring back like bring the community to us. Because this is not something that I can take out to them. They just need to know that within the walls of Kings County, which serves that entire Flatbush area, that there is this service in there that it's unique to many places, and it's there, and we have served hundreds and hundreds of patients without having any issues negatively wise, because my entire aim is to ensure that once the patient comes in there, they're leaving with full satisfaction. If something doesn't work out in that favor and I'm aware of it, I usually ensure that they get the satisfaction at the end and don't be re-victimized. So the community, I mean, I strive for that, and I think I've achieved it. As I said, I started out in Kings County so young that I saw, I've been through Kings County through 3 transformation of emergency department. So if somebody knows Kings County, they'll know where we came from and where we are now. And the community really, really needs us to educate them and bring them to where we are now, because it's sad, we're still not doing our due diligence to educate our people in the community. COVID hit, and every time I hear the word and the media, the Black and the browns are dying from COVID. No, we're not dying from COVID. We're dying from lack of education and lack of knowledge. And the people who have the power, like myself and a lot of us, are not giving it to our home community. So thank you again, and I just want us to know every one of us can make a difference within the neighbors. Just share. Think of when COVID was bad last year, this time, I was buying grocery for other people in line, having stuff delivered. We're not out of it, so continue to do that. Like Mike and, everyone that mentioned, these are services that the seniors need. We have a lot of seniors. Depression, they're locked in. If you have a neighbor, just knock on their door and just see how they're doing.
Yeah, and you're saying that, and something that came to my mind also is that we have the shelters. We talk about the seniors, but then we have families in shelters, and they too, they are in need. And one of the issues that we're having with them, some of them, they want housing. So we know since COVID, housing has gotten really, whack. It's worse than it has ever been. And when you look around, you see young people homeless on the street, walking around looking for garbage cans and stuff, and it hurts my heart. And then sometimes you find there are people in the shelter with the children, and they want to get out of the shelter. And then when they get those programs from the government programs, we're trying to place them. And then you get those landlords, and they say, hey, yes, we do have an apartment. And then they would go there. And when it's time to do the papers and everything, so there are 2 things that they turn them away with. No children. If they have children, they say, oh, well, come back. And then they turn them away and they don't get the apartment. And if they have a voucher. So anyone that you should come across, who should complain to you about that, please let me know. Don't hesitate to let me know. And these are the areas. So I do a lot of trainings. I do workshops. I do know your rights workshops. So if anything that is under the umbrella of discrimination, please call me and let me know, and our office will take care of it. Because we have a lot of shelters in our communities, and that many a times you will walk past a building and it's a shelter you don't even know. So our people in our community, they really need us. And I think that even as a community board, those shelters we should know who they are, because we have shelters in the community and we don't know that they are there. Some of them, they're just under the microscope, and we need to know, because we need to reach out to them and we need to help them. Pamela, go ahead, and then we'll hear from Ms. Odell. It's 8:05. Pamela?
Yes, I'll wait. I'll make it.
Go ahead.
I'll make it short and sweet. So, as an ambassador for the state, I like to keep you guys informed. And the young lady that spoke about her program, put your information in the link so I can contact you. But the major
Which
funding.
one? Which one?
The young lady with the college in Korea. I didn't
Okay.
write her name down.
Oh, Seoul? Okay.
So yes, the social emotional learning. So for Empire, so the American Rescue Plan, critical investment supports after school programs, summer learning, and other expanded learning through the $2.2 billion to address the learning loss. So that's about 629 million provided directly to the state and 1.6 billion directly to the local school districts. So the local school districts have to report back to get community input and have voice in what are we doing with all the things that we're talking about. So they have the after school providers, the parents, the community, and that deadline is July 1st. So it's just an opportunity for the community to get involved in education, to talk about, they have the Empire State after school, the Advantage after school, the extended learning, the extended day school violence prevention, the youth development program, the summer youth employment, and the New York State Sonic funds. All of those are getting phenomenal money. So the question becomes, how do we as a community find out what's going on in our schools, and how do we play a role in supporting youth and families and the homeless and all other stuff we talked about as a community? So it's the state is just looking at how do we build those relationships and make that kind of connections from the local level to the state level to the municipalities to the city. So how do we support our communities, and how do we make sure
that information is very good, and I really want you to put your information in there. And I would ask our first vice chair as well as district manager to take your information, because we have two committees. We have the education committee, and then we have our youth committee. And this information would be really good information for them to really work with, and then to do some more digging, and maybe they can contact you also to get some more information. So thank you so much for that information.
And that's why I asked about the sexual exploitation for children and youth. They got $2 million set aside for that, and they increased it up to 500,000 compared to last year. So if that money is in our local communities, then how come our low income communities are not getting and having voice?
Yeah.
Yes. Okay. That's it. That's all my reporting.
We need to tap into the resources. It's there, and it's all left to us to really go get it. Because most of the time we just say, no, this person is doing this and that is not been doing anything, but we are not go-getters. We just like to complain. So it is our, sometimes it says that charity starts at home, but we are not being, it's not charity for us right now. We coming together, and then we are a supermen and super women, and then we're going out there to make it happen. Yeah.
Yes, the harvest is plenty, the laborers are few.
Definitely.
Yes, yes.
So we go out there and we'll be reaping. So
Yes.
Thank you so much. So
Okay.
I'm going to hear from Mr. Dell, and then I'm not gonna let my co-pilot down. So then the last person I'll hear from is my co-pilot, and then I'll let you go. Ms. Flato, go ahead.
Yes, I'll keep it very short. First of all, I just want to thank you for really being so engaging and involving everybody that comes on, as you call kidnapping. I was one of those people a few months ago. So, but I just want to say that my organization, the National Association of University Women, we are not academics, we're activists. We are, women who are educated, college educated, but our mission is really one of service. So that's why we have continued to be involved on this committee. And if anyone is doing, activities, outreach in the community, we would definitely like to be informed so that we can help and get the word out to the community. And we do have, our organization is very intergenerational. We have members aged from 20 up to 99 years old. One of our founding members is actually 99 years old. So I just want to put that out there. You know, we're here to not to talk. We're here to actually be of service and make a difference in the community.
Yes.
Thank you. Thank you
Thank
so
you.
much. Melissa?
Is it possible for people to kind of share some information in the chats, because it's kind of quick and then I'm not getting, you know, to be able to write everything down, but like, you know, because one of the things I am working to do is to do a food distribution in our community. And I have actually am in contact with some of the people in Community Board 9 to make that happen. And so I would also like to talk to Adele, and I'd like to talk to Pamela and different people who are on here, but I don't know how to get a hold of everybody.
So
I'm putting my information in now.
Okay.
Yeah, I would recommend everyone, put your information into the chat, and then off to the right side of the chat, you might be, I don't know if you guys have the same screen as me, but you might be able to save the chat.
Yes,
Yes.
yes,
As a
we
PDF,
can.
so you can have that information.
Yeah.
Yeah, because that food distribution, because I know a lot of seniors, who would really love that type of service, because we have seniors who are not able to go out, and some of them, they had issues getting the medications and stuff like that. So those services are just great. So I'm so happy for that. Go ahead, Melissa.
Yeah, no, so I'll keep it very brief as well. So by day, I work at the New York City, Avery, can you give me a second? By day, I work at the New York City Department of Health, and we are doing a couple of series around reimagining health equity. I do not have the flyer with me right now, but I'm going to send it to the community board, and we'll send it out to everyone. We did the first one actually 2 weeks ago, and it was awesome. So I'll send that to everyone. And that's it. That's all I have for today.
So we are here to support each other. And as I said, when you come here, we become family when you come on this platform. So any programs, anything that you are having, it doesn't matter what it is, just send it to the board and they will get it to me. They do such a good job with it. And then our new DM, he himself would just send me a text and he will reach out to me personally. And then the first, our first vice chair, sorry, he does the same. The office, our office, we have phenomenal staff at the office, and they make sure that all the information that they send it to me. So anything that you are having, any programs or anything, just let us know. And right now, you will be part, each person here, because we have Miss Blair, we have Miss Flato, we have Enid's email address. We have Miss Cummins' email address. For those of you that we don't have your email address, please put your email address in the chat, so we can add it to our mailing list. So whatever is happening, so when you send it out, we all will get it. If you have a flyer, send the flyer to us so we can support you. Okay, so we can attend, and then vice versa. So we'll be there for each other. So any programs that we are having, that we will, because we will have different areas, different things that we're doing. We're doing health and social. So different programs that we're having, and I'm so appreciative of each one of you, your contribution for being here, and your willingness to work together to join in with us, Community Board 9, to make our community, to just enhance the quality of life for our people in our community. I thank you, and if there's anyone else have to say anything, I will give the last word to our DM.
Wow, really put me on the spot there. Okay, well, it was a pleasure to meet all of you. Some faces I've seen before, some brand new. This is my first time participating in this committee's meetings. Hopefully, I get the opportunity to come back. But it's awesome to see so many organizations across Brooklyn and in our community board, to become involved with the community board. One thing that I have made clear when I was interviewing for the position and once I was appointed is that I want to make sure that our community board serves as a depot of information, and we disseminate that information to the residents of this community board. One thing that I've seen constantly from working in the city council to HPD and DHS is that there's a lot of programs that the city of New York offers, but people just don't have the information. And it's going to be important as we move along and this community board continues to grow. And what I mean by grow is we start to see more participation from people in the community, is that we get everyone on board and we start disseminating information. You all have great organizations, and I want to be as helpful as I possibly can, helping you reach your goals as an organization and as an individual. So please, if you ever need the community board, please reach out to us. We have a great staff. They're extremely competent. I'm very lucky to have them as I've been transitioning into the position. But please know that the community board is there for you. Reach out to us whenever you need us.
Thank you. So Rashida, game night in June, July, yoga night. Remember everyone, and we'll be inviting their friends. So the game night in June, and whatever food Morris will be cooking in June, we know we have to work it out because all of us are gonna go try to make that dish. So there are two dishes that we have to do is the salmon and the spinach and whatever else next month that so our chef for the cooking next month is gonna be, I will not put it out there. It's gonna be a surprise. So invite a friend, and our meeting, we meet the first Thursday. The reason why we are meeting tonight is because of the holidays. So we had to shift it. So our meeting is the first Thursday of every month. First Thursday of every month at 7 p.m. This is just a shift for tonight for the 15th. It's always the first Thursday. I look forward to seeing each one of you again. I have your contact number, so I'm gonna use my GPS if I don't see you, and I can come looking for you. So just hope that I say have a good night, stay safe. Remember, in all that we are doing for our community, we have to take care of ourselves, self-care, stay safe, take care of your family. And remember, I'm looking at Soul, and Soul has a big heart on her chest. And everything that we do, let's do it in love and love one another. Have a good night, stay safe. And for those, Ms. Blair, thank you for your presentation. All of you, thank you for participating, and love you guys. Have a good night.
Have a good night.
Thank you. Thank you. Good night. See you
Bye.
guys.
Warren. Bye.
Bye.
Yes.